सो डॉक्टर करण, कभी कभी ऐसा हो जाता है कि जब ये प्री प्लानिंग की बात आती है तो बहुत सारे डॉक्टर्स जो होते हैं पेशेंट्स को प्रिस्क्राइब करते हैं कि सीबीसीटी, एक हम लोग 3D एक्सरे जो कहते हैं हम लोग बेसिकली इन लेमन टर्म्स, तो वो कराने समय भी उसका भी कॉस्ट कभी कभी पेशेंट्स को ज्यादा लगने लग जाता है.
So basically, CBCT, like doctor said, is a 3D X-ray. The other full mouth X-ray is an OPG, which is a 2D X-ray. It's a two-dimensional X-ray of a three-dimensional structure. So basically, you can see only in two dimensions. And like he said, when you can see it in dimensions with the help of a CT, especially in lower wisdom tooth extraction cases, it makes a huge difference while doing the extraction for the person who is doing the extraction. So ये जब कोई डेंटिस्ट प्रिस्क्राइब करता है, इट इज नॉट लाइक योर मेडिकल प्रैक्टिशनर्स. मेनी पेशेंट्स फील कि हाँ ये लोग फोकट में टेस्ट प्रिस्क्राइब करते हैं, जैसे एमबीबीएस वालों का टाई अप रहता है विद ऑल दीज डायबिटिक एंड ऑल दैट सेंटर्स. ऐसा कुछ नहीं है, हमारा कुछ टाई अप नहीं होता है, हमें कुछ कमीशन नहीं मिलता है इसका. तो we have to send it out because the machine to take that X-ray is very expensive. And
Yes.
many majority doctors cannot afford to keep it in their dental clinics. So it has to be referred outside, unfortunately. So the doctors are not getting any commission because majority patients feel that the tests are being prescribed because it is for the doctor's earning purpose. ऐसा कुछ नहीं है. So in fact, in our cases where commissions are offered, also we tell that to reduce the charge for the patient rather than
giving
it to us, because it is helpful for the patient, and in turn it is helpful for us while doing the surgery. Because if you see a particular, I'll show you examples of cases where how a 2D X-ray and how a 3D X-ray makes a huge difference in the extraction. Because what you see in a 2D X-ray and what you see, the inclination can be completely different in another angle. So this is only seen in one particular angle, it's a straight view. But in the other angle which we want to see, like I will explain, I will show it to you, the angulation is completely different, and that completely affects how you are going to plan to remove that tooth.
Yes,
so taking that 3D X-ray makes your procedure less precarious, less harmful for you, and spending 2,000-3,000 rupees for that is not a very big amount. For peace of mind and for lack of damaging permanent damage to vital structures, and a comparatively easy extraction. It is not going to make any difference in the long term. It is a very good X-ray. In fact, if possible, for every lower third molar, it should be taken.
Yes.
But again, like Dr. Kunal said, finance becomes a factor. But it is your loss. It is nobody else's loss. It will make your procedure easy.
Yes, correct.
It doesn't make it any different for us. The more we know, the more data we have. It's very simple. The more data you have about a certain thing, the more sure you are about what you're going to do with that data.
Yes, correct.
So if you don't have the data, you don't know what you're getting into. Because most of the times the wisdom tooth are submerged, or they are not at the right angles. They are kissing the adjacent teeth. So in all those cases, we really don't know exactly at what angle. But when you take a 3D X-ray, you can of course see every angle. You can turn it around, ulta pulta, and see it in all ways. So that makes the extraction very easy for the surgeon, very comfortable for the patient. So that, I think that misconception should be kicked out, that that it is just for prescribing sake that we are prescribing. No, it is for your sake. It makes the procedure better for you.
Yes.
So continuing from where we left off, Dr. Kunal, we were explaining about why CBCTs are needed for lower third molar extractions. So the next indication for a CBCT or a 3D X-ray is
root canal treatments.
Complex root canal treatments. Especially what we call as root canal retreatments. If you would have seen our previous video, we discussed about what are root canal retreatments and why we do, in our practice, we do majority of retreatments. So just to summarize, a retreatment is a case where a root canal has already been done and there is a impending infection, pain, swelling, in spite of doing a root canal treatment. In many cases, with a normal 2D X-ray, we are able to diagnose what the problem is. But also there are 40 to 50% cases where everything looks okay on the 2D X-ray, but still the patient is having continuous pain, or there is an infection. Like one of the cases which came to my clinic, the patient had extra oral swelling. There was a swelling on the outside of the mouth, and we took the of a very old root canal which was done elsewhere, and the swelling was there. So we took our normal 2D X-ray, which is the OPG, and also in intraoral X-ray. And on that, everything was looking okay. The root canal was looking fine. We could not see any lesion underneath the root. We'll show you on a 2D X-ray how a lesion looks, and we'll put up the X-ray which I have, where it looks absolutely normal, like there is nothing. But still, there is a inflammation. There is a swelling, infectious swelling for the patient on the outside of the mouth. So then, since nothing was seen on the 2D X-ray, we send the patient for a CBCT. Then, when the CBCT came to me, and I started analyzing the CBCT, I will put up the video of me analyzing the CBCT. And when we analyzed it, there was a very big lesion or an infection, like you call it, which was only seen on the CBCT. It was not seen on the OPG, which is the full mouth 2D X-ray, and it was not seen in the single tooth X-ray that we take. Nothing was seen. It was looking like there is no problem at all. Why is there swelling? So we thought that the patient has fractured the tooth or it has to be extracted. But before getting to such conclusions, we always prefer taking an additional diagnostic X-ray. So we always do that for the sake of the patient, where if not required, why should we extract the tooth? If it can be saved with a re-root canal, which was and correct the problem. So we found a huge lesion on the CBCT, which is not seen on any other X-ray. So that is the advantage of doing a 3D X-ray. And then we were able to do a re-root canal for the patient, and the tooth got completely saved. The patient is completely asymptomatic, and then now the patient is under follow-up, where I'm 100% sure that the lesion will heal. So we will take a post-operative CBCT also, and we have informed the patient about all the possibilities. So in turn, it became a great service for the patient just taking that one X-ray, where otherwise it was indicated for extraction.
Yes.
She was told also by 2 other doctors that it will have to be extracted due to a fracture. But we insisted that we see the CBCT, see if there's a fracture, and then decide to extract. So since we are talking about fractures, 2D X-rays seldom show fractures on when we view them, but when we see them in 3D, we can clearly see a fracture line, because we can see it in all angles, in all sections.
Yes.
We'll show you how it looks. So we can detect cracks in many cases. So that is a very good tool for fracture detection, where everything looks okay, but still there is pus and infection, and even after doing a root canal treatment, it is not resolving. So vice versa, we can save a tooth from getting extracted. Also, we can save a tooth from being unnecessarily treated, and which is indicated anyway for an extraction, and extracted. In both ways, it is advantageous for the patient. Okay, coming to the next indication for the CBCT, which is I feel the most important case where we should take a CBCT, which is mandated again by the law before you start, is the dental implant placement. So a dental implant has to be placed in an envelope of bone. It should be surrounded by bone on all 3 sides. Many times what you see on the X-ray, which looks like abundant bone, even in the mouth, when you see clinically, you can see that you feel that there is abundant bone. But when you take a proper 3D X-ray, you realize that what you were seeing was not bone, it was just soft tissue. It was just the gum tissue, which looks very thick. In some cases, the gum tissue is very thick. So it looks like there is abundant bone. And then when you take an X-ray, it's very thin bone. So in such cases, before initiating the implant treatment, if you take a CBCT, you can see the bone, and then your plan of action completely changes. Rather than cutting the patient open and then seeing that flat bone, and then tweaking your treatment plan according to what you're seeing after opening the patient. So here what happens, you're able to give the patient the accurate information. You're able to suggest them bone graft if required, and patient also is well informed before starting the treatment. So that becomes a very important indication for taking a dental CBCT. So implant placement without doing a CBCT in majority of cases is not advised. That is why we always prefer in our offices to take a 3D X-ray, so that there are no complications for the patient. We can see exactly how much distance is there, how much space is there. We can choose the implant pre-surgery. Many technical things are taken care of just because we know where we have to drill, what we have to drill. So that becomes a very important indication for the patient and for the doctor. So everybody is on the same page and we get great results in such cases. Any other indication, doctor, if you feel?
So CBCT also becomes very vital in cases where we can see on where there are cysts present.
Okay.
And so on 3D X-rays, we get to see where exactly how big is the lesion, what is the extent of the lesion.
Yes.
Is it involving any
Vital structures.
vital structures? All these things also can be very easily seen in 3D X-rays.
Yeah, 3D X-ray becomes very important in cases where there is a cyst, dental cyst, as we call it, because if you take a 2D X-ray, you do not know the depth and the width and the height and what bone is involved and what structures are involved at a clinical level. The moment you take the CT scan or the 3D X-ray, you can immediately see and measure. So accordingly, you can take your incisions. Accordingly, you can do a very conservative cyst removal just because you know where it is present, how much it is present. But it is a very great diagnostic tool for all such indications. Like we said, dental implants, third molar extractions, which are medium to complex, and cyst and lesion detections, root canal treatments, root canal microsurgery, and it's a very good follow-up tool after you do all these procedures to check whether it has healed properly. Because like I said, when you take a 2D X-ray, it shows healing, but at some angle there might not be healing. So that can be detected and necessary steps can be taken. So all in all, to summarize the video, I would just like to say that whenever any doctor prescribes, dentist prescribes 3D X-ray or a CBCT, it is only for the benefit of the patient. Like I said in the beginning of the video, we get a lot of information, and that information only helps us to do a more conservative treatment for a otherwise big problem for the patient. We can conservatively treat you since we have all information at hand, most of the information at hand. It helps preserve your vital structures, it helps preserve your gum tissue, it helps preserve your root anatomy. One more major indication is for finding out missed anatomy while doing a root canal treatment. Many times root canal treatment is done, everything looks okay, but still it is not healing, still the patient has constant pain, sensitivity to hot and cold. Why does that happen? Because many times in teeth there are additional anatomy present which cannot be clearly seen on a 2D X-ray. So I will show you one such case where, because we had a 3D X-ray in hand, we could find out 4 to 5 canals in an upper third molar, which otherwise is an anomaly. Nobody even will look for the 4th and 5th canal. Maximum people will look for 2 to 3 canals. And because of the CBCT, we are able to clearly see it, conservatively prepare it, and without losing a lot of tooth structure for the patient, we are able to give a proper restoration which will last long. So again, before doing even a fresh root canal treatment, sometimes normal teeth have some anomalous anatomy where otherwise there is one root, but there are 2 or 3 roots in such cases. So we'll show you such cases where it looks like one, but there are actually 2 or 3 extra canals or extra anatomy, which helps us do a better treatment and which will give the patient a better long-lasting result, where we don't end up unnecessarily grinding more tooth structure, just finding that anatomy. When you see in a CBCT, it is exactly there. You can measure how far the canals are, and that is to the millimeter, it is accurate. And exactly where you see it on the CBCT, you will find it in the oral cavity. So what happens is the access cavity that we make, it will be very conservative. So I will show you another case where that helped, where we could make a very minute access cavity and diagnostically specifically prepare those canals without losing a lot of tooth structure. So all these are only for the advantage of the patient. There is no advantage for the doctor in prescribing. In fact, people only feel, like I said in the beginning, कि हम लोग पैसा कमाने के लिए करते हैं. ऐसा नहीं होता है. हम लोग best interest of the patient is the only thing that is there in our mind when we give any diagnostic test.
Yes.
So all I would like to say is thank you for watching the video. Thank you for patiently listening to what we keep saying. Please like, share and subscribe to the Dental Boys YouTube channel. Thank you.
Thank you.